Krishni, love.
Hi.
Thank you for coming.
Thank you. It's a pleasure to be here.
So tell me, what are some of your pain points?
Jenna, some of my pain points. I've been with Stretch for a while, and when I first walked into here, I walked in limping. I walked in a little bit more kilos than I have currently, which is still a little bit extra. But when I came in here, the quality of my life was greatly reduced. I had come off a car accident a few months before that. I fractured my ribs. I had displaced my hip, and my knee had been crushed. And after seeing my ortho, my biokineticist, and my physiotherapist, all of them were of the view that I needed to have, at the minimum, a hip operation and a knee replacement.
Oh, wow.
And it was just an advice at that time of a friend to say, have you ever done Pilates? And I was like, I've never done that. That's probably just for rich aunties, right? And then there was this advert about a studio opening up in Belito. And at that point, I thought, what do I have to do? Let me just come and check it out. And it's been, I think, over 18, maybe it's even 2 years since you guys have been here. I've been here as long as that journey. And I walk like a normal person now. I can jog, I can run again. My quality of my life has been improved. Yes, I still have my niggles, but I'm not the person that walked in here all those months ago. And I have not had an operation. I've not had the hip operation, I've not had the knee replacement, and I have the range of motion again that I didn't have. So I owe a lot to Stretch Pilates and all the different instructors that have worked to actually keep my quality of life improving every single time.
What an amazing story.
It's a true story. It's a true story. So I'll never look back. It's so easy for me to say, I'd rather not go to that meeting or do this to be here, because it's really, really, really helped me on my
Make
journey.
that time. Well done.
Honest testimonial.
And so today, what else are we gonna refine? Just move you and then find something.
Yeah, absolutely. I know for sure my hip is still, there's an imbalance. So one is tighter, like the right side, and the left side, which eventually was the one that dislocated, is much looser. So there's that compensation that takes place between the two that has been the process of also working on. So I think that's definitely an issue. And of course, lots of things that your brilliant mind will spot.
So I'm like scanning. So you tend to hyperextend the right leg, and then the left knee buckles a little bit. And I don't know if that's also because of like how you're standing or chatting to us, but it looks like this one wants to be straight and this one keeps bending. Do you tend to not weight bear on this left side?
I think I might be doing that unconsciously.
Yeah, because the foot's even living forward. It looks a little bit like it's checked out.
Yeah, because what I notice is when I run, the pronation on the shoe kind of shows that there's something off. So they're not pronating the same way. So the right one actually looks like it's being eroded at the ends here, and the left one looks a lot better. So they don't pronate the same way. So it tells me I'm doing something more here, even though this is the tight hip.
Let's pop a squat. So you're going to take your hands out in front of you and bend your knees for me. And then I'm going to see, okay, and then stand and go again. Do you feel like you are even, or do you feel like you're using the right?
I feel like I'm doing this.
Yeah,
and then I'm consciously trying to
you're taking your center. I can see, like by the seam in your pants, that you are squatting on the right. Come up for me. And then that left knee is kind of pitching in a little bit. Stand on your right leg. Only your hands can come down. And
stand on your right. Stand on your right.
Stand on your right leg. So yes, that's correct. And then you're going to move that left knee back and forward. Yes. Okay, let's do the other side.
So looser hip.
Yes.
But and there's not much cartilage here, so it's always interesting to spot the differences.
And so do you feel like it's weaker and less stable?
I feel like it's less stable. So it's where it wants to do that, and I want to go in this direction, but I don't always get it right. But here it's like, this is tighter, but in a way it becomes more stable. So I can like, do this.
Let's go up onto your tippy toes.
Oh, nice.
Cool, and down. And again. Now we come down, you're going to stand on your right leg only and go up onto your tippy toes of your right. And down. Yes, it's hard to balance. And we swap legs.
Interesting. You
think footwork on the reformer.
Okay, yes. Don't tip over.
Okay, all right. We've got something to work on here. Single leg calf raises, always tough. Onto your hands and your knees for me.
Hands and knees. Okay.
Okay, so 4-point kneeling. Good. You're going to take your right leg back behind you and lift it up in the air. Okay, and I'm looking what the bones of your back are doing when you're weight bearing on just this unstable, like weaker left leg, and then down. And let's do the other leg. So you're going to alternate. Good, solid. And then down and alternate. Come down and do the other leg again. Okay, and then you can come all the way down. Right, let's get you on your back for me. Lying on your back, you're going to have your hands at your side. Lift your right leg up as high as you can. Keep them as straight as possible. Straight and even more. Yes, that's locked out. And then go down. Lift your left leg up as high as you can. Straight. Good, and down. Let's alternate again. Do the right one. Excellent. And then lower left leg. Good, and you can rest. You are really looking good, knowing what you've been through and where you're at now, feeling the discrepancies between the two sides. You're managing to adjust for it. Every time you move your leg, you know what needs to anchor and then what needs to drop. And then, so there's these micro changes that you're doing in your body to allow you to still lift the legs well, and you know, so there's awareness.
Yes, but that awareness actually came from a lot of the interactions with the different instructors. Keep pointing it out. Even when I'm on the mat, someone would say, initially, like, no, but you're actually at an angle. Let me realign you. So that awareness of the hip and the knee has certainly
so
come
you
from
got great mind-body connection.
It's somebody triggered it here. Lots of people triggered it.
It's missing in so many people when they lift their leg, but the whole body implodes so that leg gets a little high. So well done. You're able to, you're not shifting weight too much. It's actually quite tricky to gauge where your weaknesses are. They don't show up on your body as much, but you feel them. Yesterday, I was speaking to a client in Mount Edgecombe, and her parting words was, I've been waiting my whole life to feel as good as I feel now.
Wow.
It was so cool. And you've managed to mitigate these weaknesses, and you found a way to actually show up really strong. Like, I can't see the weaknesses so easily. I will find them, Chika.
I have no doubt.
I'm going to find them. Tuck your tail and lift your hips. Good. Now stay there. Extend one leg away. Good. Okay. You can come down. I'm happy. I've found something. Extend your left leg. Good. And then come down. Extend your right leg for me. Don't shorten your trunk. Reach this foot to me and then pick up your right hip by twisting. So you need to lift the right, not with the right side, but use your left side body to swing this up. Do you see it coming from here? Kind of dip. You were lifting from here. Yes. You were using your sides. Come down. Give yourself a rest. Extend the left leg. The other one. Yeah.
The other left.
Yeah. Extend that leg. So you reach it towards my hand. Yes. And then come down and swap again. Good. No compensating. So you got to get the height from this side and the length out this leg.
Right.
Good. But you see what this knee's doing?
Yeah.
It's pulling out. So pull it in.
Wow.
So you got to connect inner thigh.
Yeah.
Glute medius, lift, and get long in your waist.
What a feeling, firstly.
Come down and keep alternating. That side is easier. It's just your so all you have to do is make sure that this is level.
Yeah. So interesting is that looser hip from an injury means that it can do a little bit more, but this tighter one is actually becomes stable. So it's almost like anchoring.
Yes. And this exercise, so come down for me. And have a moment. So come all the way down and then come sit up, and we're just going to chat. You know when you have a wall with a floating shelf?
Yes.
So if the floating shelf is made of hard wood, it's solid. It's like, that is hard. It's irrelevant if the floating shelf hasn't been attached to the wall with deep enough screws. That hard, solid floating shelf will fall off.
Yeah, makes sense.
Okay, so that's what we're dealing with now when your leg is extended. Doesn't matter how hard this leg is trying. This one that's in the air is not the guy.
Yeah.
It's the leg on the floor.
Yeah.
That is the one that's making you stable and controlled. Same way, this next exercise. So get onto your left elbow.
Left elbow.
Yes. Okay.
So many lifts.
You're going to watch some videos and see me doing this with other humans, and you get to chuckle because you're going to know what this feels like in your body. You're going to lift up your hips. It's one of my favorite. This arm goes up to the ceiling. Shove your hips forward. And the reason I love it so much is you've got this knee connecting to the ground.
Yes.
So that means we've got closed chain strengthening happening in this hip.
Mm-hmm.
There's so much feedback on both ends. And you're going to keep the dent in your side bum trying to scoop and activate. Like we're trying to excavate that side bum dent.
Yeah.
And you keep working that. This hand can go behind your head, all the way back behind so that your elbow, let's move it to about there. Elbow melts forward. Shoulders should feel happy. Ribs are in. And you're going to extend the right leg away. Great. Keep this active. The leg is going to lift up and down like that. Yes. Abs are in. Bum is forward. Now, which leg am I working?
The left leg.
Yes. Shove, shove, shove. Tuck your bum. Juice that lemon.
Juice that lemon. Oh my goodness.
And 3, and 2, and 1, and then come down.
Nice.
Okay. So we want to do closed chain exercises on you. There's another one I want to do with you.
Top of the box.
Get on top. Stand on top of the bed, and then you're going to turn and face that way.
Sure.
Stand on your left foot and push your right foot into this box for me. But you're going to lift the foot a little bit. You know what? Can you step a little bit further out to the left? A little bit? Yeah. And then pick up this foot and push it solid into the box. So lift your toes, lift your heel, lift your toes. You can lift them all the way up for me. Straight leg, there's it.
Oh, wow.
Yeah, bro. Straighten the right leg for me. And then you press into the box with your right foot. And so you're needing to try and learn to get that dent.
Yeah.
Straighten the leg. Get your dent. You're allowed to lean over a little bit. Head's got to be in line with the rest of your spine. And you're going to push your pelvis towards the box as well. So you just shove like that. Yes. Do you feel that?
Absolutely.
Okay. Breathe. Relax your arms. Keep working your dent. Get taller out of the floor. And keep pushing your heel. Oopsie.
It's like the form is going.
It's not. We're going here. Keep pushing your heel into the box. Okay. So you have straight legs.
Relax shoulders.
You relax shoulders. You're allowed to lean over a little bit. And you're going to lock this leg. And that leg has to clear the ground, so that's cool.
Yeah.
Because then I know you're working this bum enough.
Yeah, I am. I can feel something.
Good. You're going to pull your hips towards me. Yes. Straight legs. And I don't mind keep repeating the cues because our body defaults, so we got to keep having it on repeat anyway. Straighten out this leg. Lock it. And then square your pelvis. It's wanting to rotate. Good. We do 3 sets of 30 seconds. You get to do the other side.
So other side is?
Turn around.
Turn around. Right.
Okay, so you stand about 30 to 40 centimeters away, and then you push your left foot into the box.
Left foot in.
Yeah.
Right.
And then you're going to keep tallest, and lean over slightly, close these ribs. Lock the leg, shove the shin. You could actually put the heel like slightly further back of the other one. So not that one, sorry. So the left leg is going to go slightly further back of the weight-bearing heel so that you get more back of glutes. Otherwise, people might use the front of hip. And ribs are in. And that's good. I'm only sitting on the box because the box wants to move because she's so powerful.
Shaky, shaky legs.
Good. Square it off. So I like to say head lamps on your hip bones, and your head lamps need to shine forward. The body likes to twist, and there's some rotation in your spine. So your compensations are like small, micro, like movements in your vertebral, like in the middle of your body. Okay, square. and then relax.
Whoa.
Okay, so you're going to sit with your feet over this edge, like this.
Okay.
And then you're going to put your left leg here on here. Yeah, and your right foot on that thigh. And then your left hand is going to go underneath your Achilles tendon. And your right hand goes up to the ceiling. Okay, it's hard for you to sit there. Can you feel?
Most definitely.
Your spine is veering off. You need to take your body over and reach for your foot. Let's just start by putting this hand here. Grab it. Hang on for dear life. And lean back for me. Now head back into my body. Knee down if you can.
Can't.
You okay?
Yeah.
Okay, so you're leaning back. And so we want to get into the obliques, into the QL. Then you're going to go over. And you keep trying to open. How does that feel?
Pretty tough. Pretty tough.
If you find your knee is a problem,
It's almost
on the floor.
So it's almost like here is the tightness.
Yeah, so no, we're going to go up. That's just a restrictive experience for you. Not
it might be different on the other side.
Yeah, I think it will be. But let's keep this leg on the floor. Take this one out and then grab it and put your hand up and see, does that feel better?
So much better.
Okay. So we were being held back by this legs.
Could be the knee.
Yeah, we'll just call it the leg, knee, hip situation. And our aim is to stretch this. So let's take that friction away and get into that side body.
Nice. Lovely stretch.
Very nice. You can do it over the edge of your couch, your bed, a chair. Just the only thing is you do want something stable to keep the other leg on. So good. And when you come up, you don't windmill up. You got to come up almost gently by walking yourself back up. No, not a big 1 rep max. No, none of that.
Nice.
Other leg goes down. I want to see.
I'm having a feeling it's going to be entirely different, and I'm excited to see this different. So let's see. We're here. Do we want to try the original way?
Original.
Because see, I can do this already.
Yeah, and that's the one with
the looser, the injured hip.
The looser hip, yeah.
So,
and then you want to grow up and out of your pelvis and go over here. Does it feel good?
Beautiful. This feels so nice.
It is such a nice stretch. And often the tightness in the hip, it's felt in the hip, but it could be coming from attachments on the iliac crest, which is the pelvis, you see. So you could have there was a lot of trauma to that, your body. And then come up slowly. Let's try the left foot on the floor. And there are a lot of studies that show like we hold stuff in our middle.
Yeah.
So whether it's orthopedic or also just how you breathe and how does it feel?
Amazing.
Good. When you come out of it, you're going to rotate and then clamber back up. Good. Now I am intrigued by that hip. Lie on your back. So we need to see. We could spend a lot more time together discovering things.
This is absolutely incredible.
Yeah, it would be fun. So I want to be as efficient as I can with this leg, just so we.
It doesn't give you too much.
No, there's not much happening here. Okay, so and the hip's not sore; it's just tight. Eh?
Yeah.
Okay, so it wasn't actually traumatized.
No, it's just compensated for this one. It's the knee that doesn't have much cartilage, so I think it has its own issues.
Yes. Okay, so
but it's not sore.
But it shouldn't be. There shouldn't be fallout from trying to get more range.
Yeah, I think so.
Okay, so we need to get more range in this one. It says that you might struggle with glute stretches because everyone wants to do figure of 4 stretch, and your knee might not be happy.
I can only do it well on one side.
You do well on one side and on the other. So there's other ways. You can stretch your bum by taking it across your shoulder. So hold onto the thigh with 2 hands and then pull the knee across. Okay, how does that feel?
Nice. I can feel the stretch.
Okay, so now you're getting a bum stretch. So everyone else in the room is going to do figure of 4, and you just immediately do. instead of going out like this,
Yeah.
you go across.
Okay.
So even if they're doing the figure of 4 stretch on the reformer and doing this, you just put your foot off the edge and you do that. It's the same thing. It's such an easy change.
Thank you. Yes.
Okay, so that's your bum stretch. And then I really want to open up your TFL muscle. So you're going to hold onto your ankle, pull the foot across your body. It shouldn't hurt your knee if
No,
it
it's
does.
not, and
You
it's
just
not.
slip
It's,
something
and it's
behind.
not. It's not.
And you pull your foot across and you put it
Yeah.
on the floor there. How's that feel?
Nice. I don't think I've ever done this.
Okay, so you try and get it down.
I didn't think the leg could reach there.
I do worry about the rest of the body bending over. So you must just try and keep straight. And then that is trying to open this.
Yeah.
Yeah.
Lovely.
You've got some tools in your box.
Yeah, I didn't think that this was possible, by the way.
Yeah, it's cool, huh?
Yeah.
And relax. Now let's see the weaker, more flexible side. Okay, more range.
Yeah.
So it can do the figure of 4.
can do the
How
figure.
does it feel across the body? I think it'll also feel nice.
Also feels nice. Yeah, definitely feels nice.
Yeah. Keep waistline long, so don't let it shrink. So you see what I'm seeing in exercises that you do in class. You've already got all the cues. They've stacked in your brain. You know how to make your corrections. Novel exercises, you still need to figure it out.
Yes. Yeah. Yeah.
Okay, so you're going to hang on to the knee with 2 hands, and then you're going to pull it to that shoulder. That's cool. Can you, within your own body, realize your headlamps on your hip bones need to still be square? So you must take your left bum bone longer. Do you feel that?
Yeah.
Okay.
Okay.
Is it possible?
I'm trying.
This one
Yeah.
has to go longer.
Yeah. It's a mind workout, hey? It's a mind workout as well.
And then these headlamps on your shoulders must still stay square.
Now I feel it's very different, the feeling. Because now I can feel.
Yeah.
Oh, yeah.
So you don't want, if you've got your...
Because I could just be doing this.
You could be doing this. You could be doing that. You got to keep them, your box. It's called your box. So you need to keep your box.
Okay, it's that.
And then let's try the TFL one where you grab your ankle and you pull it across and put it on the floor. Foot can go nice and high. Easy peasy. How does that feel?
Nice.
Now, when you deranged the hip, did it tear and cause quite a lot of overstretch and trauma to that left hip?
I think because the hip bone moved out of place. And that's why they were, and it has like this weird thing that happened there. It did cause a stretch, but the way it was described to me is that my body is compensated to the right. So it's actually the hip shouldn't be a problem, but the way you've compensated it, you've actually introduced this loose, imbalanced side thing.
Cool, which can be improved upon.
I think so, yeah.
Awesome.
Because initially they were like, you need an operation to fix this.
So the reason I also ask is just to see how badly that was affected, because if I go and give you lots of stretches for something that's already quite unstable, like this might not serve you.
I think it will serve me because
Okay,
I couldn't
gauge.
even walk properly when I got here. Seriously,
let's focus on the human in front of us and let comfort be your guide. If I'm giving you stretches and you feel too fragile during the stretch and after the stretch, then maybe the stretch doesn't serve you. But if the stretch makes you feel better, then that's maybe a good sign.
Yeah.
So we don't want to be issuing a whole bunch of stretches to a very unstable, loose joint, but also maybe it would benefit from strengthening the right way and having a couple of stretches that don't ask too much of it. My concern is that I make you feel worse, and I don't want that.
I'm very doubtful about that. It's interesting. Ooh. I always thought maybe the focus for me would be to loosen up the right hip.
Yes.
Because it seems like that's the one that struggles as a result of what it had to do.
The stretches have shown us that, or the range of motion test we did shows us that this has very little range. It needs more range. This one needs more stability.
Yeah.
So,
two very different issues. But
everyone's been throwing out the word balance a lot lately, so we'll go with that. We just need a bit more balance.
Yes, I love it.
Cool, well done.
Yeah, I feel absolutely amazing. Thank you so much. Really learned this.
That exercise is quite cool, huh?
Very much so, because I could feel that could strengthen quite a bit for me on both sides, and it's not an easy exercise. It looks like it's child's play, but as you're doing it and it's also trying to get yourself taller, you can feel that everything's trying to work out to try to keep you in position while strengthening you.
It's one of the hard things when you're dealing with half a body that needs one thing and another half that needs something else. You also like being efficient, right?
Yes.
So you want an exercise you can sink your teeth into. That's a good exercise for you to sink your teeth into. Often when you have tightness, we want to do hard things because you're capable. But for that right side, we actually need to loosen it and do stuff well. And then for the left side, we need to make it stronger.
Thank you. There's so many things that I'm going to go and practice with, especially using the wall, being in the bed as well, and doing that unique little stretch that's not quite a figure four. It's going to really help me.
Cool. Use it in the class as well.
Use it in the class as well. When they say figure four, I'll do that.
Yes.
Thank you so much. This has been amazing. I'm so grateful for this intervention session. Cool. It really feels like an intervention. Thank you again as well.